Now, right on to item 8, which are staff presentations. There'll be 2 presentations today regarding the Community Benefits and Social Value Procurement HSC 24042, otherwise known as FCS 24069. So there'll be a 20-minute presentation from folks who are not procurement staff, and then a 10-minute presentation from folks who are procurement staff, about 30-ish minutes. On that, those who are here to present are Tina Yackel, the Director of Procurement, Carrie Brooks-Joyner, the Director of Strategic Services, and Brianne Gashko, Senior Project Manager. And I'll leave it to you to take it away whenever you're ready.
Thank you, Chair. I'm Carrie Brooks-Joyner, Director of Strategic Initiatives in the Health and Safe Communities Department. We are very pleased to present this work today to the subcommittee. It's been just over a year since the project started till today. The work was kicked off following the first Community Benefits Subcommittee meeting that was held in September of 2023, and Brianne Gashko was contracted internally to complete the research, and that work started in November of last year and was completed this past April. There were many tense weeks at the end of the report, at the end of the project, as all the files and the nearly completed report were inaccessible for a while as a result of the cyber attack. But in the end, all the files were recovered and our blood pressures dropped dramatically after that. Yes, yay, it was for sure. So today we are sharing 2 reports. The first is the staff recommendation report on community benefits and social procurement, as was directed by this subcommittee. It is a joint report from Health and Safety Communities and Corporate Services. This report summarizes the research that was done, the lessons that were learned from other municipalities, and recommends a path forward for the city within a general social value outcome framework. The second report is an information report in which staff reports back as directed on the student-led work and recommendations from the research shop at McMaster University. This is also a joint report from the Healthy and Safe Communities and Corporate Services. Today's presentation will focus on the findings of the staff-led research, analysis, and recommended next step. And although the contract for the research project was completed in the spring, we have borrowed back Brianne Gashko, Senior Project Manager, from her new position in housing to share her work with you today. Tina Yackel, Director of Procurement, will provide additional information on the proposed pilot project. And over to Brianne. Okay, so Clerks has the presentation. Thank you.
Hello and thank you. I'm Brianne Gashko, Senior Project Manager, now in Housing Services, previously with Strategic Initiatives, working on this body of work. So I'd like to just begin by talking a little bit about the first recommendation in the staff report, which is surrounding the terminology used to describe this work. And after conducting research and both through, next slide, please. Through both a thorough review of current literature and a comprehensive jurisdictional scan, we identified the terminology that's most frequently used to describe this work, the sources of confusion and common misunderstandings around these terms, and the direction that Canadian municipalities are taking when it comes to naming and defining their programs. There are 2 overarching terms that emerge most frequently. These are community benefits and social value. And these are often used interchangeably to describe the same outcomes. So leveraging spending to deliver additional positive outcomes to a community that go above and beyond a project's primary deliverable. In the early 2000s, the community benefits movement, which I know many of you are familiar with, emerged in the United States, and this was due to an influx of money into development and redevelopment projects. This term community benefits that we're using today is really a carryover from that, and that term has changed and morphed over time to really encompass and refer to anything in which a benefit is being provided to a community. Today, the community benefits movement is still very relevant, but we do have a shift in this language and in what it refers to today with some new legislation and some new uses of that term. So I just want to talk about why we see, and I'll talk about this more in the jurisdictional scan in a moment, but why we see a shift toward the language, the social value language, and more specifically, social value outcome as the deliverable here. So we do see most Canadian municipalities who are approaching community benefits type work, they're positioning their programs within the procurement division or procurement team, often referring to their work as social procurement, just for the sheer simplicity of aligning language. Social value outcome, social procurement. So for that reason alone, there's alignment there that makes sense. And I would say the biggest reason really that we're starting to see a shift just in the last few years is just around the confusion of the term community benefits with two other key terms, and I'd like to speak to those now. The first one is there's something new that's come about in the last few years called community benefits charges. And these are fees that a developer is required to pay to the municipality if their project meets certain criteria, as outlined in the new Section 37 of the Ontario Planning Act, which was introduced in 2022. So quite recent, but that terminology, community benefits charge, is sometimes misunderstood as community benefits as the overarching term. We also see conflation between the community benefits and community benefits agreements. And community benefits agreements are specific legally binding agreements between developers, typically government bodies and community organizations, to leverage spending to provide benefits to a community. But sometimes there is that confusion between CBAs, community benefits agreements, and the umbrella term community benefits. As a result of this, we are seeing a shift in the language, and this is becoming industry standard now, social value. There are a number of municipalities in Canada who have been using community benefits language over the last 5-10 years. And I can tell you from the research that I've done, some of them are looking to shift toward this social value language or social value outcome language because it's really has emerged as this industry standard. And on to the next. I would like to share just for a little bit about the jurisdictional scan and the research that was done as part of the staff report, the recommendation report that's before you today. A robust jurisdictional scan was completed. It is attached as Appendix A to the report. It is a large appendix, so I do want to give a little bit of a highlight to what's captured in that scan. So we conducted in-depth interviews with 13 municipalities across Canada. And these in-depth interviews occurred over phone calls, virtual meetings. Sometimes we spoke 3 or 4 times to circle back to receive updated information and to reconnect on the work that we were doing. And within those 13 municipalities, we did collect research across 16 programs. This is because there are a handful of municipalities that have both social procurement type programs as well as community benefits programs. So there are some that have both. And so we did cover that across the municipalities we connected with. In addition to these interviews, of course, we did look at and review the policies, their programs, staff reports, and all of the associated written material that accompanied these programs. I would like to just highlight who we spoke with. So some of our Greater Toronto, Hamilton area and Ontario comparators, including the City of Mississauga, City of Brampton, City of Toronto, Regional Municipality of York, Region of Waterloo, City of Waterloo, and City of Ottawa. Municipalities in Western Canada included the City of Calgary, City of Edmonton, City of Winnipeg, City of Regina, and City of Vancouver. And in Eastern Canada, we spoke with the Regional Municipality of Halifax Regional Municipality. So in these conversations, we did really connect over kind of 12 key areas. And I won't get into every area, but to give, again, a bit of a highlight here, we discussed development timeframes, staffing complements, the organizational structure of the program, the education and training required both internally and externally, as well as the current state of the programs in these municipalities and the next steps for them. Some are in the process of revising or renewing or redeveloping their programs. What was perhaps one of the most useful things was the discussion on the challenges and successes in both the development and implementation of these programs. I'll just point out here a couple of the stats you see at the bottom of the slide. So of the municipalities we spoke with, 100% of them have social value procurement programs, and 30% of them have community benefits programs. So those would be programs specifically designed toward administering community benefits agreements for the most part. You'll see that 68% of programs have dedicated full-time equivalent positions, and over half of the programs took 2 or more years to develop before implementation. And we'll move on to the next slide, please. Now, just to speak about the jurisdictional scan just a little bit more, I do want to highlight some of the lessons learned because our recommendations have been really impacted and influenced by the lessons learned from the jurisdictional scan, and it really is the backbone of the report that we have before you today. So what's important to share here is that one of the biggest things that we found is that municipalities are, more and more municipalities are embedding their programs within their procurement divisions. So they're leveraging their existing processes, policies, and team structures to be able to deliver this work. And we're seeing that more and more. Another thing that we're seeing is that the entire process, when you're positioning within procurement, it is managed by the city. So the city can lead and control most aspects of delivering social value outcomes when they're positioning it within an existing team. There were conversations about municipalities that had other programs, community benefits programs, for example, who had to leverage staff across departments and didn't have a formalized team for that program. And by and large, that was resulting in challenges actualizing the goals that they had set out to achieve. There's also something, interesting to be said about the fact that social procurement can leverage spending from across the organization. So you're not tied to just certain projects or certain levels of spending. You leverage the spending on a large infrastructure project in the same way that you might on a small catering contract. So there is that opportunity across the corporation. So a couple other key points that I do want to share is the process of testing and validating a course of action before formalizing a framework or program is something that we heard consistently in our interviews. So it was really a test it out first and figure out what works for your municipality. We know that there really is no plug and play approach to providing additional benefits for the community. What works in the Toronto landscape doesn't necessarily work in the Mississauga landscape and vice versa. So that was one of the key pieces of advice that we received. I can say that there are a number of municipalities that have had programs running for 3, 5, or 7 years. They're in the process of redeveloping those and renewing those because these sorts of programs need to consistently respond to the needs that are specific to the community in which they were developed. And that's something to keep in mind as we move forward. Start small and test it out first. Those were some of the phrases that I heard. Another critical piece was having enough time to develop a program. There are municipalities who reported that they had less than 1 year to develop their program, noted challenges with the implementation phase, with the education, both of the internal and external partners, and of meeting the goals that they had set out to meet. So that is important as well. I'll also just speak briefly about stakeholder education and engagement. Something that also came up quite frequently was that this is somewhat misunderstood work, sometimes internally and externally. And so creating educational materials and providing opportunity to understand what social value criteria is or what a benefit to the community is was also a key to success. And finally, subject matter expertise and dedicated resources with this subject matter expertise. We'll move on to the next slide. Now, I'd like to share with you here, I've got a graphic of our Hamilton's approach to a social value framework. And you'll notice in the staff report, we refer to this as phase 1. And you can really look at this graphic as a high-level visual representation of the City of Hamilton's framework toward achieving benefits for the community or social value outcomes. And I'll walk through this kind of briefly with you. On the left-hand side here, you'll see the graphic circled in green with the city-led above it. This is what we're identifying as in scope for phase 1 of this approach, phase 1 of the framework. And we are looking at piloting a social procurement program and using 2 main mechanisms within social procurement to leverage additional benefits. And there's kind of 2 main ways to do this. So there's embedding social value criteria into RFPs, RFQs, RFTs, and there's also under threshold purchasing. So direct purchasing that aligns with that kind of social value framework within the organization and across the organization. You'll see on the right-hand side, we have externally led. Now, this is something that we're identifying as out of scope for phase 1 of the framework. And this is externally led because we're speaking specifically about community benefits agreements. So those are, as I mentioned, those legally binding agreements between developers, government body, as well as community organizations. And community benefits agreements are often private sector development, not always, but often the case, and something that certainly is a way to leverage additional benefits, but we're identifying that for a phase 2. So what we're really sharing here is that our framework could include both of these options and these pathways, but that we approach the city-led social procurement pathway first. And then once we have a moment to test it and evaluate it, there's the opportunity to change the scope and to scope in more avenues through which to obtain additional social value outcomes. Again, this approach has been informed by the best practices that were learned from other municipalities. And again, I won't speak at length about this, but just as a reminder, it's the leveraging the existing team structure and process. So situating this program within procurement and using it as our foundation on which to build would set us up for success. Starting with smaller scale projects to work through program details before moving on to, let's say, really large projects. And approaching this work, through procurement and through some existing resources that we already have there, again, provides us with adequate resources to move this work forward. The other important thing just to note about this proposed phase 1 is that this would really allow the City of Hamilton to test and validate an approach to obtaining social value outcomes through city-led processes first. And that would really be a critical first step in solidifying the City of Hamilton as a leader in this work before we delve into external projects. Ultimately, this phase 1 approach focuses on an effort that the city can control, has the most results for return on investment, and we can achieve this within an appropriate time frame. Okay, and we'll move on to the next slide, please. And just one more slide, just to talk about social procurement very briefly. We'll go back to the next slide, sorry. Wonderful. So what social procurement is and what it is not, sometimes it's as important to define what something is as it is to say what it's not. So social procurement is a city-led process. It's an opportunity for social and economic benefits. It is scalable. As mentioned, there are so many ways to approach social procurement, and depending how that pilot is framed or how that program is framed, there are many avenues through which to explore this. It's an efficient process because we do have that foundation through our existing policies and our existing processes. And as mentioned, it's applicable to the purchase of service and goods across the corporation. What social procurement is not, it is not private sector development. So social procurement would not pertain to that private large infrastructure development. It's not limited to capital infrastructure projects. And it's also not a program that would require supplementary agreements to existing procurement contracts. So a little more streamlined, if you will. It's also a program and a process that does not require third-party monitors, something that often is required and is important for community benefits agreements to see those through, but definitely creates an extra layer to that approach. And I will pass it on now to Director of Procurement.
Through the chair, Tina Ayako, Director of Procurement. Next slide, please. Although the research reveals that there's no standard approach or program across municipalities, key learnings from other cities and efforts are that developing a social procurement program requires time, resources, and subject matter experts. Learning from other municipalities strongly suggests that piloting social value projects to test, evaluate, and refine approach before formalizing a program is more likely to lead to a successful program and that meets its intended goals. So as we did in 2018 with the previous pilots that we've run, we're going to follow a similar path in conducting small-scale pilots using evaluation criteria. We're going to look to bidder questionnaires and potentially have some weighted outcomes for social value in any of our tenders and RFPs. Of course, prior to the implementation of the pilots, we're going to do significant outreach to vendor community as well, and more importantly, with the connect organizations to ensure that we really have that supply of the workforce and we have work-ready candidates in order to ensure the successes of our pilots, and we're in embedding any of those requirements certainly in our tenders. And then once we've run a few of the pilots, we're going to look back and assess any of the positive outcomes and the challenges that we were faced with running those. Next slide, please. So with the support of the two GMs, the joint report back from the Corporate Services and Healthy and Safe Community Departments and to the Community Benefits Subcommittee, we're going to identify required skills and competencies, potentially additional FTEs, and a program structure for the Social Value Procurement Program as phase 1, as a strong step towards embedding social value outcomes within the city. Other supporting departments and divisions will be brought in as needed. This will ensure that the pilots developed and implemented with a citywide approach. And as well, we are going to seek the subject matter expertise of the Procurement Advisory Committee, which is a committee of staff, for their assistance in overseeing the development of our corporate training program and our workshops in order to instill social value meaning throughout the corporation and how our employees and staff can embed social value procurement into their procurement processes. Next. So these are our next steps. As part of the capacity to build the support of this type of work, a special projects position was created in the procurement division, and the recruitment for that position is underway. The work to develop and implement the pilot will be incorporated into this position's work plan for 2025. In addition, existing sources have been identified within Healthy and Safe Communities to support the pilot in 2025. And following the approval of funding and the authority to engage a consultant, procurement staff will initiate a competitive procurement process to engage a consultant. Next slide, please. And this is just a snapshot of the timing. So with 2021, we are going to start resourcing and getting some boots on the ground for the pilot after we finish off our recruitment. Certainly going to do stakeholder engagement, and then we're going to come back to potentially this committee with any outcomes for the pilots and then start the pilot programs in Q3 of 2025. And I believe that is the end of our presentation. Thank you.
Thank you very much. At this point, what we're going to do is take questions on the presentation. Then there's actually a report with recommendations. I'll give a little preamble about how we're going to navigate that, and then we'll take comments, movers, seconders, all those kinds of things on the report. So before we get to the report, just any questions on the presentation that was just delivered? I'll take a speakers list. I see first Councillor Huang, Member Nikolskaya, Member Andrus. Councillor Huang, take it away.
Thank you. Just through you, Chair Brianne, when you were doing your conversations with all of the other municipalities, were they able to share with you actual documents and policies, like an actual framework on how they were making decisions on all of these different ways of doing it?
Through you, Chair. Thank you for the question. There were a number of municipalities that do have their actual framework documents, and they're available. Most of them are publicly available. So yes, those were shared by the municipalities that had developed those. There are some municipalities who went straight to developing a policy and led with a policy. So yes, those that had them shared them.
Okay. My second question through you, Chair, is when you were speaking with all these other municipalities, did they talk about how they brought it forward to the rest of the organization? Because it strikes me that to move forward on something like this requires some level of change management. So I was wondering, did they actually share with you some of their sort of challenges or what they did in order to actually roll it out across the organization?
Yes. So one of the pieces that we did speak about in particular was about how this work actually came to be in the organization and who championed it first. So that was a really interesting conversation with each municipality, whether was it council, were there community organizations, was it staff-led? And that definitely changed the approach in each municipality with how they were able to approach it. Socializing this idea was incredibly important for each municipality. So having conversations internally and externally during development was really key to success. And part of the work that we did internally was I spoke with various departments across the city to talk about what social procurement is, what community benefits are, what this might look like if this is something that we did moving forward. So those very, very early phases of kind of socializing this idea across the corporation. In terms of bringing it forward, at other municipalities, it was really important that they had a kind of internal guiding groups. So there is, you'll notice in the appendix, there is a part of the chart there will identify whether they had a working group or a consultation group, who was that group moving it forward within the corporation. And that was relatively common and somewhat correlated with later success of the program.
Oh, okay. Perhaps just as an additional supplemental then is as municipalities are rolling this out and they need to be able to talk about this externally, did they speak about what were some of their experiences with just socializing this externally? Because you do want community buy-in as well. So what was that like? Did that come up in conversation at all?
Through the chair, yes, that did come up in conversation. And the external socialization of this concept is really important too. And that's a little bit what I was touching on when I spoke about the stakeholder engagement and education. So kind of getting ahead of implementing a framework or a policy and connecting with those external vendors and service providers was critical in other municipalities. Some held information sessions, some circulated actual training slide decks out to their kind of key vendors. So there's a number of approaches that was discussed in the conversations.
Oh, excellent. Okay. My last question then through you, Chair, is about level setting and benchmarking, because I do know in your, and I don't want to talk about your report yet, but it was just one of those, like, as we're starting from a time zero and we're at the base level at this point, when you were having these conversations with other municipalities, did they share with you how they benchmarked themselves? I think it's more complicated than just saying we had it and we don't have it, or we're at zero because we haven't had it. And then I just want to understand, how do we level set ourselves and how do we benchmark this so that way we can get a better evaluative framework as we move through this pilot phase process and that sort of thing.
Through you, Chair, just for clarification, Councillor Wang, are you referring to as municipalities progress in this work, how they evaluate themselves against?
Yes, themselves.
Measure against themselves. That's a really wonderful question. So some of the municipalities that are further advanced in this work, so those that have been doing it for 5+ years, many of them are finding themselves either at the phase or have started to conduct this work of doing thorough evaluations and of identifying, using many set SMART targets. So using those SMART targets, creating that baseline and using that over time. There are some that, recognize that they jumped in and they didn't have time to maybe develop that baseline for themselves. And that's something that they're going back to now. But certainly the evaluative tools, was a challenge. I would say noted more often than not that was a challenge for municipalities, and there are a number of them that are looking back to that now to develop the tools and develop the methodology through which to gather the information so that they can make decisions for the future and share some of those data outputs.
Sorry, Chair. SMART, is it SMART, SMART, like community-specific, measurable? Or are you saying other SMART, like what do you mean by SMART targets?
Through the Chair, yes, my apologies for the acronym. Yes, the specific, measurable, attainable, relevant, and time-bound. Yes, those.
Okay. Thank you. Those are all my questions, Chair.
Thank you.
With the Chair's indulgence, can I add to that answer?
Take it away.
All right. One of the strong lessons learned was there was no one way to do this work, and certainly the range of benchmarking also reflected that across municipalities, either done really well or not done at all, and all the way in between. Part of the report back to committee with the proposed pilot would be benchmarking suitable for the City of Hamilton, if approved, to go forward with that work.
Thanks very much, Councillor Huang. Member Nichols-Kaya.
Thank you. Through you, Chair, I have a few questions. Let me know if I have to add myself back to the speakers list. Through you, Chair, to the Senior Project Manager, just some questions as I'm trying to lean into the argumentation and regarding the change of the terminology to social value. You had remarked that one of the changes to legislation was the community benefits charge, renamed in 2022. That's a relatively recent change. You noted that as well, whereas the term community benefits pre-exist this pretty considerably, but you mentioned that there is confusion around this, whereas I would imagine the confusion would rest and burden, in fact, the charges. Are there any tangible examples of where this confusion led to issues, whether locally or jurisdictionally?
Through the Chair, thank you for the question. So the piece about there being confusion or kind of even conflation around those terms, that emerged through conversations with each municipality. One of the key questions that I asked them was, why have you chosen to name your program what you've named it? How are you defining your terminology? So we went through kind of the nitty-gritty on the terms, and something that emerged from those conversations was there's a number of municipalities, as I mentioned, and as you're aware, that have been doing this for many years, right? 5, 7, 10+ years. Those municipalities, by and large, have used terminology aligned with community benefits, so they're using that language. And in those conversations, it started coming up that because of the recent changes in the legislation, that they are seeing confusion internally within their own organization about community benefits charges and its relationship to their community benefits work. And by and large, they're not connected. So these community benefits teams, they're not leveraging money from the CBC charges. That's a very separate body of work. So they were finding it internally within their own organization. That it was starting to come up more and more, and it was becoming challenging. One municipality who's in development of their program right now, in particular, had did a whole little internal conference with their council and their senior leadership team to talk about the terminology and the naming of their program. And again, the community benefits charges was their key piece of confusion, and this is where they really moved for that shift toward the social value outcome language. I can tell you myself, even working on this within our organization, that I have received emails internally asking about the community benefits charge work when that's not what we're working on. So it's really come up in conversation, right? And you'll see that in the jurisdictional scan. So conversationally based, although there are some very specific instances as well with myself of seeing that confusion and conflation in that language. But absolutely, community benefits, that term without the charges piece, as we know, that goes back decades. And I do think I understand the merit of that terminology and what that means for a community. But you know, in light of these changes and the challenges that we're seeing across Canada and how others are responding to it, that's what informed. Yeah.
Thank you. So I'm hearing that the confusion is really condensed internally, and maybe one day if the PAL terminology changes in the future, that confusion can also be relieved that way. Another question, I'd like just a very quick confirmation, because you mentioned that municipalities are thinking about potentially changing the names of some of their CBA offices. To your knowledge at this time, none have changed their community benefits agreement offices' names.
Through the chair, yes, that's correct. So you won't see any formal changes at this point. Again, it was through those interviews and conversations that I know that that's in conversation. Yeah, absolutely.
And through you, Chair, when I was looking at the jurisdictional scan, excellent work on how much information you were able to flush out. This is a point of correlation, not causation, of course, but there's a pattern between some of the municipalities that did engage with external consultation in which the consultation and the process was 2 years or longer, because you noted that there were some that were less than 2 years. So there's a strong correlation, just seemingly, that if they engaged in external consultation, the process took longer. Through your conversations, through you, Chair, did you find any reason for why that correlation may have existed other than it just is a coincidence?
Through you, Chair. So, I mean, I can only speculate on this. I can't share definitively why that might be the case, but for the most part, the municipalities that did engage consultants to consult on their work, there tended to be more internal buy-in for this work. That being said, there was sometimes more time allotted to development because there were big goals that were being set. There were commitments being made internally to advance this work. And as many of us know, when we want to do something right and do something well, it often takes more time, maybe sometimes than we would like. So those municipalities that did involve consultants, I would say there was a high level of internal buy-in in those organizations. And, you know, as a result, more time to develop those and to really kind of flesh out those programs. Again, that's what I gathered from those conversations and how I would speculate that correlation.
Excellent. Through you, Chair, do I have time for a couple more questions? Yeah. Through you, Chair, to Director of Procurement. On one of the slides in the presentation, it was noted about some additional departments at the city being part of the social procurement pilot program, such as healthy and safe communities and corporate services. Is this an exhaustive list, or was there consideration, or is there any consideration for any additional elements? I'm thinking about in the report, there's a notation about the City of Edmonton, the City of Regina, who also engaged in Indigenous procurement framework. So I think they worked with additional departments. So just wondering about your thoughts if those two departments are the exhaustive list.
Through the chair, no, it's not exhaustive at all. If anything, it just briefly touches the two departments. Certainly we have to work hand in hand quite a bit with the Public Works Department, because when we issue the tenders, we're going to be looking to their project managers and their directors to engage which connector organizations would fit best with each pilot being imposed. So when we did this in 2018, 2019, it was a corporate-wide effort. We had we worked hand in hand with the healthy and safe communities, but certainly Public Works for the most part, corporate services, we work with them quite intensely as well.
That through you, Chair, that's wonderful to hear. Obviously, that kind of collaboration is fantastic. So thank you for taking the opportunity to clarify that. And my last question is, I was just really struck, as mentioned in the, maybe I'll leave this question for discussion during the report because I just wanted to comment about something from the historical background. Sorry, it is connected to the timeline. No, I'll ask it now.
Go for it, yeah.
Yeah, thank you. So it noted in the report under historical background, it talked about some of the issues during the 2018-2019 pilot, in particular about lacking the necessary staff resources and capacity, which led to issues including some of the projects not being able to be monitored for social value outcomes. In the timeline that was presented, you're thinking about resourcing and how to resource this pilot moving forward in the next quarters. Any additional information you could provide about ways in which that could be resourced to prevent those issues from that pilot in 2018-2019?
Through the chair, this time around, we have the position that is not dedicated to social value procurement, but a good chunk of their work plan will be. When we did the pilots in 2018, 2019, we had hired an external consultant to assist us, but pretty much all the work was borne by the procurement specialists in order to work with the consultant, work with the client departments, do some of the outreach, issue the procurements. Unfortunately, by the time we had issued a few pilots, we didn't have the opportunity to go back and do any benchmarking to see if anything was successful, because at that time we were directed to stand down. So that's where we left it at. Hopefully with this, with the implementation, the development and the implementation at least, I'm looking for the special projects SPM to assist with that, and then it'll get handed over to the procurement specialist. But at that time, we'll have to reflect as well to see if it's sustainable in that respect, or if we need to ask for additional FTEs as well, just to monitor and continue it on.
Thank you. Thank you, Chair.
Very welcome. Member Andrus, thank you.
So in the presentation, I just wanted to ask a couple of quick questions. Excellent work on the jurisdictional scan and the reaching out of municipalities. Thank you again, as always, for your incredibly hard work on a very comprehensive look at other municipalities and their jurisdictions. So I wanted to ask, one of the things that you mentioned during your presentation was specifically around an internal staff and culture training piece. So I'm wondering if that might be one of the ways to overcome some of the challenges with the provincial government's renaming of community benefit charges. The other question I have is in the presentation and the jurisdictional scan that you did perform, I didn't see a lot of mention of the federal community employment benefits program, which a lot of municipalities have accessed outside of even their own social procurement or social value or community benefits divisions. And it is, although non-mandatory, in our talks with the federal government as community benefit networks, it looks like the federal government will be moving more towards adding those community employment benefits to both their new housing funds as well as their public transportation funds. So I'm just wondering, was it just a timing issue, or how in the jurisdictional scan we did not get in this report that, some community employment benefits, because there's been a substantial number of those awarded under that federal program.
Thank you. Angie Burden, General Manager of Community Services, through you, Councillor, to Carl. One of the significant changes that has been happening with Ontario Works is the divesting of employment contracts. So the landscape in which we find ourselves today is very different than 6 years ago, 7 years ago. And there, in fact, are other communities where Ontario Works still retains the employment contracts as well. Certainly, we can be doing some education. We can be forming relationships and developing I guess the best way to talk about it would be hosting conversations to leverage those kinds of opportunities. We have much less leverage and ability to meet employment KPIs because that work does not fall under Ontario Works in the same way that it used to. But certainly we can host conversations with the contract employees that are working on those deliverables. I wanted also to mention to an earlier question around is it only corporate services and healthy and safe communities? Part of what we wanted to model with GM Zagaric and I is the recognition that while social value procurement may rest within procurement and corporate services, really it does need to be, to your point, the education of the corporation, and it needs to be embraced from a cultures and values and expertise from the client group. So GM Zagaric and I are, if you will, co-chairing this work to provide some, I think, reassurance that this is not going to run as a procurement project buried within a division, a single division within a department, but really, in fact, is a corporate-wide commitment. Thank you.
And then my next question through the chair is in the presentation, there's a mention, of course, about community and stakeholder engagement. And through the chair to you, GM, you've identified one of the challenges with the City of Hamilton and OWODSP and employment services being removed. I believe Toronto is slated to go through a similar process in Q2 of 2025. So they'll be, dealing with some substantial challenges of their own in the way that they handle these types of situations. But I am aware that there are a great many, including members of the Community Benefits Network, employment service agencies, not-for-profits in the City of Hamilton, who do a lot of great employment service work funded both federally and provincially. So in terms of that stakeholder consultant and in terms of the next steps in terms of the social value outcome pilot that you're proposing through this presentation, I'm just curious where those organizations would fit into that stakeholder. I heard a lot about internal stakeholders, city stakeholders, but I didn't hear a lot about community and outside stakeholders and engagement. So I wanted to see, because it's sort of mentioned in the presentation around this engagement, if you could flesh that out a little bit for me. And another thing from the presentation that you briefly mentioned, and then is mentioned in your excellent jurisdictional scan, is the guiding principles that are developed by various municipalities for how they're going to undertake this social value procurement. You mentioned it, alluded to it a little bit in your presentation, but I'm just wondering again on that stakeholder piece on how you plan to frame those questions and how to get the best terms of what the Made in Hamilton solution is, as it were. Thank you.
So through the chair for your first question, Carl. I think it's in our best interest to go back to see what we did in 2018, 2019, and what we did well. And with respect to the external engagement, it'll be basically once we hire the consultant and figure out what the scope of work will be for the consultant. Perhaps at that time, it's putting out some communications to the community, to all the communities and the stakeholders within Hamilton, to open the door again for social procurement and to see how they would like to be engaged and when they would like to be engaged. And I think it's a two-way conversation. I really can't put my finger on this time how we go about that, but I know it's got to be that two-way conversation between the external community and the City of Hamilton, and then we'll need to bring in the vendors as well. So what we learned from the first pilots we did, we couldn't do enough community engagement and conversation. So we're going to revisit that, look to see what we did well and capitalize on that, and look to the consultant to see if they have any other suggestions as well. And we're certainly open to the Hamilton Community Benefits to offer suggestions as well. Thank you.
And last question through you, the chair. During the presentation on social procurement on your frame with the city-led and externally led mechanisms and embedments based on your best practices from other cities. I am just again curious on were there other areas where this differed? It seemed, especially in your beautiful report on jurisdictional scans, that the most successful ones of these social procurement pilots especially tended to have internal staff champions and internal staff supports, even if it wasn't necessarily resourced. Some were resourced, some were just spread across city divisions. Some were just staff generated, some were council directed for the policy creation. So I'm just curious on that social procurement piece on exactly what you think that the adequate resources are available to undertake small scale social procurement pilots as you mentioned in the presentation. Are the resources there, and is there adequate staff championships in your opinion set up based on the kind of the knowledge that you've learned through this presentation from other communities?
So perhaps I'll start and then turn it to Tina. One of the things that we did with the recommendations is look at what would be feasible within the resourcing and the structure currently of the city. And we do require a consultant for the pieces that Tina had previously mentioned. We believe that there would be champions across the organization, depending on who the appropriate client group would be for the particular social procurement that we were looking at. And I think the first part of the question was around the resourcing, but that's been factored into the recommendations that are there. It's different than having a dedicated staff team that is committed to the work ongoing. It would be one-time resourcing to come in to really start these pilots, and then I believe in Q3 come back, or Q4 of next year, come back to provide longer-term recommendations based on what has been learned. I'll turn it over to Tina if she wants to add anything.
Through the chair, no, I'm good.
So, through the chair, so that's the timing chart that we're looking at here with the Q1 pilot resource and planning, Q2 stakeholder engagement, Q3 pilot implementation, and then Q4 report back in 2025.
That's correct.
Thank you. That's all the questions I have on the presentation.